Well, the Cartiva implant allows you to maintain range of motion, and it's not a very invasive operation.
I use the synthetic cartilage implant instead of a fusion in patients that want to maintain their motion, patients that are still very active and are willing to trial something that may in fact not last their entire lifetime, but allow them to continue to have activities for years and years.
For me, the biggest benefits of Cartiva is pain relief that is reliable, motion that is maintained or improved, and easily convertible to a fusion. The fact that we do not lose a lot of bone when we implant the Cartiva, so that if patients do need a fusion down the line, it is not a difficult surgery to perform.
Just the ability to preserve motion. A lot of patients feel very strongly about wanting to do that, and this gives us the potential option to do that.
Cartiva works so well and the expectations are so high that people feel that they can get on with their life right after surgery. To get the Cartiva into your toe, we have to do surgery. And surgery does cause problems, of course. It causes healing, inflammation. And if you don't respect that, you're going to have difficulty and you're going to have a prolonged recovery. So I spend a great deal of time counseling patients on, even though they're allowed to do everything, we really want them doing at the most half of what they would normally do. So you have to respect the healing process over a period of 6 to 12 weeks to really get that maximum benefit early.
It taught me a lesson when I first started putting in the Cartiva to educate the patients better, to make sure that their expectations were that at 3 months was when they'd start to see the pain improvement and they'd be able to function, have increase in function activity because their pain would be lessened. So I joke and I always say, don't judge me for 3 months, because that's what it's going to take for that biology.
And when talking to patients, you have to counsel them that there is a spectrum of recovery and that they have to be patient with the recovery. And if they're on board with that and they understand that, then as they go through the recovery, they're not frustrated.
The most attractive thing about the Cartiva implant is the simplicity and the lack of any type of complications that can occur with it. It is a simple device, it has good outcomes, and it has very low risk when you put it in. And if patients don't like it, they have an alternative to do something different.
It's a neat material, and I think there's going to be a bright future for it in orthopedics.